Biomarkers in Neurological Disorders, Identifying Disease Mechanisms. Title: Biomarkers in Neurological Disorders, Identifying Disease Mechanisms. Introduction. The field of neuroscience has made significant strides in understanding the intricacies of the human brain and its disorders. However, the early detection, diagnosis, and effective treatment of neurological disorders remain challenging. Biomarkers have emerged as valuable tools in assisting healthcare professionals to identify disease mechanisms and improve patient care. This article aims to explore the role of biomarkers in neurological disorders, their impact on disease management, and their potential for future advancements. Understanding biomarkers. Biomarkers are measurable substances or indicators that can be detected in body fluids, tissues, or even behavioral patterns. In the context of neurological disorders, they are used to provide objective evidence of the presence, progression, or risk of a particular disease. Biomarkers can enhance diagnostic accuracy and aid in predicting prognosis, response to treatment, or disease recurrence. The importance of biomarkers in neurological disorders. The early detection and accurate diagnosis of neurological disorders are critical for effective disease management. Biomarkers serve as reliable indicators to differentiate between various neurological disorders, which often present with overlapping symptoms. For example, in the case of Alzheimer's disease, biomarkers such as amyloid beta and tau protein levels in cerebrospinal fluid, CSF, can aid in distinguishing it from other forms of dementia. Furthermore, biomarkers provide insights into the underlying disease mechanisms. Neurological disorders have diverse etiologies, with complex interplay between genetic, environmental, and lifestyle factors. Biomarkers offer clues about the pathogenic processes involved in these disorders and aid in understanding their progression. Advancements in biomarker research. In recent years, significant advancements have been made in the field of biomarker research for neurological disorders. The advent of non-invasive imaging techniques, such as positron emission tomography, PET, and magnetic resonance imaging, MRI, has revolutionized the assessment of brain structure and function. Genetic biomarkers have also proven invaluable in the study of neurological disorders. Genetic testing can identify specific gene mutations or variations associated with the risk of developing certain disorders, such as Huntington's disease or familial forms of Alzheimer's disease. Moreover, genetic biomarkers can predict disease progression, provide prognostic information, and guide personalized treatment options. The role of biomarkers in therapy development. Biomarkers play a crucial role in monitoring therapeutic efficacy and disease progression. They enable the identification of appropriate patients for experimental treatments and assist in establishing criteria for clinical trial eligibility. In neurodegenerative disorders like Parkinson's disease, biomarkers help track disease progression, assess treatment response, and measure the impact of neuroprotective interventions. Furthermore, biomarkers facilitate the evaluation of drug safety by identifying potential adverse effects or drug-induced changes in physiological parameters. For example, Electroencephalography, EEG, can be used as a biomarker to monitor the impact of antiepileptic drugs in epilepsy patients. Future directions and challenges. While biomarker research has shown promising results, several challenges remain. One of the main challenges is the lack of consensus on standardized biomarker protocols. Variability in sample collection, storage, and assessment methods can hinder the comparability of results across different research studies, limiting their clinical utility. Moreover, many neurological disorders are multifactorial, involving complex interactions between genetic, environmental, and lifestyle factors. Therefore, biomarkers need to be multifaceted, capturing the heterogeneity of these disorders. Integrating multiple biomarkers, such as genetic, imaging, and biochemical markers, may increase their sensitivity and specificity while aiding accurate diagnosis and treatment decision-making. Neurological disorders present significant challenges in terms of early detection, diagnosis, and treatment. However, biomarkers have emerged as crucial tools in addressing these challenges. By providing objective evidence of disease presence, progression, or risk, biomarkers enhance diagnostic accuracy and aid in predicting prognosis, response to treatment, and disease recurrence. Biomarkers play a crucial role in differentiating between various neurological disorders. Given that many disorders have overlapping symptoms, biomarkers offer reliable indicators to accurately identify specific conditions. For example, biomarkers like amyloid beta and tau protein levels in cerebrospinal fluid, CSF, can distinguish Alzheimer's disease from other forms of dementia. Moreover, biomarkers provide valuable insights into the underlying mechanisms of neurological disorders. With diverse etiologies and complex interactions between genetic, environmental, and lifestyle factors, understanding these mechanisms is crucial for effective disease management. Biomarkers offer clues about the pathogenic processes involved in these disorders, shedding light on their progression. In recent years, significant advancements have been made in biomarker research for neurological disorders. Non-invasive imaging techniques like positron emission tomography, PET, and magnetic resonance imaging, MRI, have revolutionized the assessment of brain structure and function. Genetic biomarkers have also proven invaluable in neurological disorder research. Genetic testing can identify gene mutations or variations associated with the risk of developing specific disorders, such as Huntington's disease or familial Alzheimer's disease. Furthermore, genetic biomarkers can predict disease progression, provide prognostic information, and guide personalized treatment options. Biomarkers play a critical role in therapy development, particularly in monitoring therapeutic efficacy and disease progression. They aid in identifying suitable patients for experimental treatments and help establish criteria for clinical trial eligibility. Additionally, biomarkers contribute to the evaluation of drug safety by identifying potential adverse effects or drug-induced changes in physiological parameters. For instance, electroencephalography, EEG, can serve as a biomarker to monitor the impact of antiepileptic drugs in epilepsy patients. While biomarker research has shown promising results, several challenges lie ahead. One primary challenge is establishing standardized biomarker protocols. Variability in sample collection, storage, and assessment methods can hinder the comparability of results across different studies, limiting their clinical utility. Many neurological disorders are multifactorial, involving complex interactions between genetic, environmental, and lifestyle factors. As a result, biomarkers need to be multifaceted, capturing the heterogeneity of these disorders comprehensively.